Hi, everyone.
Hi everyone, thanks for joining. Since it's 1:30, we're going to go ahead and get started to be respectful of everyone's time. Welcome to the Hospital Preparedness Program and coordinating entity for the Chicago Healthcare Coalition Request for Proposals Bidder Conference. Today is March 13th, and my name is Eleanor Duran. I'm the Grants Research Specialist for the Hospital Preparedness Program. And with me today is Molly Gabaldo.
Hi, everyone. I'm Molly Gabaldo, the project manager for the Hospital Preparedness Program.
We're just going to jump right into it. A couple of housekeeping notes. Today's meeting is going to be about 30 to 60 minutes in length. There will be a question and answer portion following the presentation. So if you have any questions, please utilize the chat feature during the presentation, and we'll take all questions at the end. And just as a note, this presentation is a summary of the RFP. If there's any discrepancies, please always follow the RFP that has been published on the city's website for the full listing of all of their requirements.
All right, so we are just going to go into some of the specifics of the RFP itself. So the purpose of the delegate agency contract is to assure the support of the hospital preparedness program at the Chicago Department of Public Health on administrative and programmatic functions. So the city of Chicago is a directly funded jurisdiction, which means that we do not receive our funding from ASPR, or the Administration for Strategic Preparedness and Response, through the state of Illinois. We receive it directly from the federal government. Our activities as it relates to the hospital preparedness program include the facilitation and coordination of preparedness and response capabilities, and work with the 35 Chicago hospitals. There are over 120 long-term care facilities, dialysis centers, and a number of other healthcare entities within the city that require coordination prior to and during public health emergencies. The delegate agency would need to provide technical assistance for planning, provide assistance in providing training on public health emergency preparedness topics, and assure that hospitals and healthcare organizations are connected to the coalition, which is called the Chicago Healthcare System Coalition for Preparedness and Response. And then, of course, the public health system within the city of Chicago as a whole. So the goal of the hospital preparedness program nationally is to assure that there are healthcare coalitions within jurisdictions and regionally to promote the coordination of public health emergency response and preparedness within a health system. So because Chicago is a separately funded locality or jurisdiction, the funding that we receive is specific to that of the preparedness and response activities within the city of Chicago. The delegate agency is needed to coordinate those preparedness activities and work to attain the ideal state of readiness through the capabilities that are listed here on this slide. It should be noted that these 4 capabilities, the Foundation for Healthcare and Medical Readiness, Healthcare and Medical Response Coordination, Continuity, and Medical Surge, are all core capabilities that have been the foundation of the hospital preparedness program for a number of years and throughout the last 5-year budget period of this grant. I think that it's worth noting here that we are awaiting the notice of funding opportunity from ASPR for the next 5-year budget period, which will begin in July of this year. And it is expected that there will be some changes to the way that these capabilities are formatted. However, these 4 categories of capabilities are foundational to the hospital preparedness program and will certainly be worked into whatever structure it is that ASPR decides. So all of the work and the delegate agencies at the Chicago Department of Public Health are guided by the following principles. It is expected that any delegate agency would align and work these CDPH guiding principles into any of the work and coordination that is occurring within their scope. So those four guiding principles are to deconstruct racist systems, to provide trauma prevention and trauma-informed services, to be culturally responsive, and to assure the work towards health equity in all communities.
Okay, so a little bit about the available funding. So there's a total of $1,447,185 available for this contract for each year of the contract. It is anticipated that the funding will remain the same at that amount for each of the following contractual years. However, I think it's important to note that congressional appropriations have not yet occurred. And so the funding is subject to change. We are currently operating off of planning numbers from ASPR. So this funding may change a little bit from year to year, but it is anticipated it'll be around this amount for each of the 5 years of this contractual delegate agency. As Molly said, this contract will begin in July of this year of 2024, and the first contractual period will go through June 30th of 2025. The contract is eligible for renewal for up to 4 additional years, each one to not exceed 1 year. So the total time would be 5 years for this contract. This is, of course, at the discretion of the city based on the eligibility of funds, like I mentioned before, the need to extend the services and the delegate agency's performance. And it is anticipated that 1 contract will be awarded through this RFP, so that total funding will be awarded through 1 contract.
In terms of scope of services for the delegate agency, the respondents will be expected to assist CDPH in completing the following grant capabilities and objectives. I apologize in advance for reading straight off of the slide, but this is vetted language that I want to assure is consistent. The expectation is that they would assist in maintaining the CHS CPR websites and associated IT, engage with vendors for the CHS CPR radio program, organize and schedule decon trainings for hospitals, coordinate advanced burn life support training courses for the Healthcare Coalition members, engage with organizations to complete Radiation Emergency Assistance Center training or REACT training for Healthcare Coalition members, contract with organizations or conducting CHS CPR exercises, contract with Illinois Masonic Medical Center to support the Healthcare Coordination Readiness and Response Coordinator, and contract with hospitals and healthcare organizations employing elected members of the HCC Executive Committee. Respondents will aid in grant capabilities by also tracking all Healthcare Coalition meeting attendance, participation, and membership, support the development of a governance structure for the Healthcare Coalition, an emergency operations plan and associated annexes, support committees, work groups, and individual or collaborative work for regularly scheduled or urgent meetings, facilitate procurement of materials, supplies, and pharmaceuticals, assist in the annual ASPR HPP application process, including providing a scope of services and a budget, assist CDPH in necessary grant reporting, and meet at least quarterly with the HPP finance team to provide monthly spend plans.
Okay, so a little bit about the budget requirements. Administrative costs should be limited to direct program personnel, fringe, travel to required conferences, IT costs for programmatic activities, office supplies for program staff, and training on required systems. And the percentage of these administrative costs should not exceed 35% of the program budget, and the indirect rate is to not exceed 10%. In terms of fiscal capacity, this delegate agency contract is on a reimbursement basis for payment. And so each respondent must demonstrate the capacity to fund any program expenditures from the start date until they are reimbursed by the city. And vouchers must be submitted on a monthly basis through the iSupplier FMPS system. So in terms of eligibility requirements for applicants, respondents must be eligible for the traditional city criteria, which is to be in good standing with the city of Chicago, have the administrative, organizational, programmatic, information technology, and fiscal capability to plan, develop, implement, and evaluate the proposed projects. And agencies with a limited capacity to administer the fiscal responsibilities associated with the programs may choose to subcontract with a fiscal and reporting agency to provide administrative services. Some additional requirements for this specific RFP. We would like to see previous experience with the hospital preparedness program and demonstrated knowledge of the HPP capabilities that are described on a previous slide with the link to those capabilities as well. We would also like to see the ability to contract with hospital and healthcare partners effectively and efficiently, and as well with training and exercise organizations. The delegate agency should also have the contractual ability to purchase medical materials and for the payment of monthly radio fees and repair costs. Additionally, there should be robust IT infrastructure to help support the maintenance of the website and membership data, as Molly mentioned, in the scope of services. There should also be awareness of hospital and healthcare accreditation requirements and the CMS emergency preparedness rules. And finally, the program manager or the lead contact of the delegate agency must be certified in NIMS ICS 100, 200, 700, and 800 to demonstrate a knowledge of emergency preparedness. So in terms of submission requirements, applicants are asked that they submit all required components to ease the review and evaluation of application. These components are the project plan, the staffing plan, budget and justification, and the demonstration of alignment with CDPH principles. All of these can be found in the RFP document if you need more information. And then this is the evaluation criteria for this RFP, and this is how the respondents will be scored. So as you can see, these are the maximum points that can be awarded for each of the categories with a total of 100. So some key dates, the RFP was released on March 6th. Today is the 13th, which we are having our bidders conference. Any additional questions should be submitted by March 18th at noon. And then the proposal due date, so the RFP due date is April 8th at noon. And all proposals can be submitted through the e-procurement system, which is linked here at the bottom. Are there any questions?
I see that we have one question in the chat from Kanitha. Kanitha, I've sort of read through this question. Is there anything else that you'd like to verbally add?
Sure. So thank you guys so much. Thanks to Eleanor and Molly for the RFP overview. There were just a few things that stood out to me. So upon reviewing the RFP and just doing a baseline, there were opportunities for insurance to increase the amounts in addition to the addition of new insurance requirements that have traditionally not been placed within this contract. Holistically, just upon review, it looks like there might be some problematic things that relates to some of the deliverables that you just discussed. What I want to know is, do you anticipate that these within the RFP are the floor of those insurance requirements, or do you anticipate those looking differently upon contract execution?
I think this is something that we're going to have to go back to risk and legal in regards to, and kind of get some clarity as to what exactly would differ based on our prior contracts. But we certainly will raise this concern. And I see there's also a question as to which email questions should be submitted to, and you can email myself, and I'll drop that in the chat and look, it's right there, Molly.Gabaldo at cityofchicago.org.
Okay, and just in that conversation, please note they're drastic. There are a number of things that are drastically different in the insurance requirements and that flow down.
Okay, cool. We'll take a second look at that.
All right.
And
And then I'm sorry, go ahead, Eleanor.
no, just we will get back to you with answers to your questions when we can.
Awesome. And then Molly, you already got it. I know where to send additional questions if we're looking through. That's all I have.
Thank you. Fantastic. Are there any other questions?
Okay, hearing none and seeing none in the chat, we want to say thank you to everyone for joining this RFP Bidders Conference. And again, if there are any additional questions that come up, you can email Molly at molly.gabaldo@cityofchicago.org. And those questions are due by March 18th at noon. And we will work as quickly as we can to get back to you with those. Thank you so much, everyone, and have a great day.
Thank you.